Hello, I'm Dr. Corey Anderson from Seattle Children's Hospital. I'm one of the team of anesthesiologists who come over to the Proton Center. We do sedation and general anesthesia for many of the pediatric patients having radiation therapy, proton therapy specifically. Because the patients need to be completely still for the therapy, the radiation, children are brought back to the anesthesia bay where they're checked in by their nurse, the vital signs are taken. And then once that's done, the anesthesiologist comes in and checks the child in and makes sure that they're appropriate for sedation or general anesthesia that day. We're looking to see if they have any nausea, vomiting, fever, or colds that may impact the anesthetic. One of the drugs that we use to keep the children asleep is called propofol. The amount of propofol that we use to give a child is based on their weight and potentially other factors such as their metabolism, other drugs that they're on. In that propofol is typically used, but if somebody has an allergy to propofol, then we would use another agent to keep them asleep. Part of our role as an anesthesiologist is to make sure that the patients are very safe during these procedures. In anticipating untoward situations, we have developed a system where we have airway equipment for those patients who may have problems with breathing. And it's specified for each of the patient's sizes. In addition to that equipment, we also put in a drug calculation sheet, and that's determined based on the patient's weight. Also, we have these emergency kits, emergency medication kits, that we carry into the treatment room to make sure that the patients are nice and safe and the emergency drugs are readily available. The anesthesia machine is in the room at all times when we're doing either sedation or general anesthetic, and that's because of the monitoring. And in addition, never want to be without a safety valve, which is our machine here, in case the patient needs to be ventilated. It's extremely important that the child have nothing by mouth, either solids or liquids, because of the risk of aspiration. And what that means is that things can come up from the stomach, get into the lungs, and give them an aspiration pneumonia. After the treatment is finished, and the child's recovered from anesthesia, they go to a special room where recovery takes place. Vital signs are taken, and a nurse stays with them the whole time until the patient's awake. If you have any further questions about any of the things that you've seen on this video, you can ask your nurse or one of the physicians. They'll give you the information you need, or will provide you with access to the resources that you need to answer your questions. Thank you so much for watching these videos. We appreciate it.